Well, hello and welcome to Rajat Sabha TV. You're watching India Fights Back with me, Rajat Kain. Well, in this episode of the show, we'll focus on the important statistics of the falling COVID numbers and what it means for us. What is the significance of the daily numbers? What we get to hear that the numbers are falling, although albeit there is some marginal variance on few odd days. Now, country is showing a declining trend of COVID-19 cases since last 4 months, and compared to similarly placed nations, the cases and death per million population in India is among the lowest. Now, these are the statistics. We are also raising a caveat here that this is just a statistics. It doesn't mean that pandemic is over. Now, as we speak, more than 97% people have been cured or discharged in India, and a little over 1.3% remains in active cases bracket. It's also important to tell that more than 20 crore people have been tested so far across the country. So has the government's strategy of focusing on testing, contact tracing, isolation and quarantine or containment has paid good results so far, and what all we need to do in future? Well, to discuss more on this extremely important issue, we're joined with a panel of 3 guests. Professor Sarman Singh is director from AIIMS Bhopal. Many thanks, Professor Singh, for joining us. Dr. Dhruva Chaudhary, he's State Nodal Officer for COVID-19 in Haryana. Many thanks, sir. And Dr. K. Madan Gopal, he is Senior Consultant Health, Niti Aayog. Well, many thanks, Dr. Gopal. It's good to have all 3 of you here. Gentlemen, let me start with you, Dr. Dhruva Chaudhary. As we are seeing the numbers falling, now just for the benefit of our viewers, these numbers which we have seen a falling trend, what does it entail? Does it mean our steps taken so far are giving good results?
Ankur, thank you so much. I think this is a phenomenon we are seeing in whole of the country except Maharashtra and Kerala.
Yeah.
And Kerala, I will keep it away because they have a very late peak. So probably now they have the peak and they're going up. I hope my panelists agree with it. As far as the north, we are concerned, along with Delhi or maybe Madhya Pradesh or in Maharashtra and Mumbai itself, we are seeing a dwindling number of cases, though at Amravati or a couple of other places, there is a slight, still continues to be up. I think there have been 2 major reasons suddenly, because when we talk to our colleagues in UK, some month of August, they were also facing the similar situation that suddenly the numbers disappeared. And there was a sense of deja vu that probably there was a sense that probably nothing is going to happen. Now, as far as the first part is concerned, you asked me, did the steps taken by the governments, whether the central or the state, did they pay? My answer is yes, to an extent that it helped us in preparing and keeping up with the clinical management of the cases. I think that did help us, one. Secondly, the testing, tracing, and then isolation also worked to begin with and did help us in flattening the curve too. 3, what is the that suddenly we are seeing there is a disappearance practically, like at my institution. At peak of the time, we had more than 150, 40 admissions in intensive care. Now, practically, there is only 1 case that also has improved now, which is lying there with us. And I think this story must be all India Institute of Medical Sciences at Bhopal also. One reason which has been probably being touted by the experts is that probably we have got or nearer to herd immunity, looking at the sero surveys which are coming up. I am not so sure of it because whatever the data which is coming up to us, definitely we see there is a predominantly urban phenomenon. We are seeing a large number of people already have it, but they had it. But whether that could only be the explanation, I think it will be difficult to say, because still we have a vulnerable population. The only thing what I can say that because of this large number of these things, probably surges has been not there. And secondly, what that is that it probably the people have been playing the so-called, suddenly you had large number of super spreaders playing a role. That has still not been studied yet, but whatever the data which has come to us from India, from especially Andhra and Telangana, it shows that probably nearly 2/3 of the events of spread have been because of the super spreaders. Now, these are the few questions which are coming up. We are debating, discussing, but we still cannot pinpoint to one particular factor which is responsible for sudden disappearance of it.
Well, that's important. That's really important. Many thanks, Dr. Dhruva Chaudhary, for your opening remarks. We'll come back to you. Right. Well, Dr. Madan Gopal, here is a question that's been often asked, and as also Dr. Dhruva Chaudhary mentioned, do you also consider that, I mean, in terms of the steps that we have taken, of course, it has led to good result. Well, is it something else we require so that to make this curve flatten even further? By any measure, we're not calling that pandemic is over. Is it right, sir?
Yes, Rajat, for any pandemic or an epidemic, the basics are very important. The basics are what is an unusual occurrence? Since it is even a single case is an unusual occurrence, we have to work till that level is achieved. Because now we are having data for the last year. That means what was the minimum transmission level during the month of February in some of the states you would be having. And we have to see that we maintain that level for at least twice the incubation period. That's the definition of any epidemic act is there. That means in this case, we have to at least have that kind of minimal transmission level for 28 days, not less than that. Then only we can say that our efforts are yielding results. Till such time, till we have achieved that level, it's very difficult to say that we are moving in the direction. Because if you look at the velocity of the pandemic, it has come down. Across the globe, it has come down.
Right. That's an important word used. Velocity has come down. Right. Sir. Right. Please carry on, sir.
But if you look at the death surges, that doesn't give a comfort to us. Because if you look at the surge in the death data, that is not comforting. Though the cases are coming down, but the deaths are also proportionately, they are not coming down with the same speed and velocity. The growth, percentage growth every day is coming down. It's negative growth for the last many days. But despite this testing, the deaths is an issue because newer states like Uttarakhand, they are reporting a surge of deaths. Goa is reporting surge of deaths. It's already, we don't know what has happened in Kerala. Studies are going on. We have to find out. We do have a different variant in Kerala or not. Every day 6,000 cases are coming and it is not coming down. Despite having the best system there, they religiously follow the contact tracing and you can't question that the diligence is not there. But still cases are coming down, deaths are there, but we have to be very careful about that. So over to you.
Right, sir. So before I just broad-based debate and also just ask include Professor Sarman Singh, just one small question, Dr. Madan Gopal. As you said, deaths, the percentage deaths for that matter, or the number of deaths is still there, which is fairly a worrying feature. Is there any data so far that in what age bracket we are seeing more demise? Any ratio proportion that we have done in terms of data?
That has been in the public domain. I think the vaccination policies were also driven by the mortality data. 80% of the deaths have been encountered in 50 plus population and more than 80%.
Right, sir, please.
That's the bracket which is there. Above 50 years, 80% mortality is encountered in this age group, and more than 80% cases are below this 50 years of age. Mota, this is the scenarios there. So we have to dig into the data to understand which are the brackets which are affected more. But the guiding principle which was formed for the vaccination drive was this one, that is 80% of the mortality happened in 50 plus population and more than 80% cases happened in 50 less population. So that was the trend across the globe also now. So initially we had that thing in the western side. Now the young people are catching up infection more, and this trend is more or less universal now.
Right, sir. Right. Professor Singh here, as we know, while the numbers are coming down, there is a concern about the surge in the demise of people who are being infected by this virus. Do you think that there are still areas in terms of a bracket population or other age bracket that needs to be addressed here? Dr. Singh.
Yeah, I think we don't expect anything new, which we already know. If you see original publication, which was published in Lancet in January 2020 from China, almost very interestingly, almost the data of the demise or the death rate remains almost same. The
Okay.
original Chinese study, they also said about 2%, and still it remains by and large. It remains depending on the what age group and some shelter houses and some countries. It has plus minus, but by and large globally, if you see, it remains the same as China reported. So the death is same, but obviously there are various confounding factors. Age, Dr. Gopal already mentioned, and then there are diabetics, obese persons, and then hypertensive, and other comorbidities. So all these patients, they are having, like in some of the states, we know, like in Punjab and Madhya Pradesh and some other states, they had very high, mortality as compared to, if you see, Delhi or otherwise in UP or Bihar. Say, for example, very, very few, even people question that in Bihar, the reporting was proper or not. Irrespective of that, the death rate in UP and Bihar and eastern parts of the country, it was very, very less. And so is this trend if you see the neighboring countries. If you see Laos has 45 cases, Sri Lanka, very few deaths. The Singapore was also like that. Myanmar had hardly any death, and only recently they had the surge. Similar is Thailand. Thailand hardly they had any case. Now they are in December and January they are having the cases. So it is peculiar. In any case, every country has to face one peak. That is fundamentally it has been seen. So peak has to come. When it will come, that is a different issue. So India had two peaks, and probably we have done our share, and population has probably developed herd immunity or immunity. What we can say herd immunity, if you see technically, it is more than 60%. We have not achieved as far as data is concerned. But we don't know whether the test kits which are available, they are really optimized to detect the low level of antibodies or not. But definitely this phenomena, it shows that probably there is a peak, and then after peak the cases are going down. But again, I would underscore that even though the numbers are going down, but no place for complacency, because we still have in Goa, we have in Kerala, as Dr. Gopal very nicely mentioned, that Kerala was praised everywhere. Whole country was after Kerala, and now they are having peak, and whole country is going, the number of cases going down, but Kerala is not having any respite. So this kind of things are happening, and UK also had earlier very few cases, and then suddenly they had. So it is the phenomena, and there are various other probably today's platform. I don't know that you want to, but definitely there are in Southeast Asian countries why the death was less and as compared to Caucasian. So there are various theories going on. But I don't know today if you are going to discuss that or not.
Surely, sir. Surely. Right, sir. Right. Professor Singh, I'll come back to you. Yeah. So let me ask you one question here, Dr. Dhruva Chaudhary. As Dr. Singh just mentioned about the peak and after peaks and the normal phenomenon, and of course, like Kerala, as you also mentioned, is having a late surge. Now, theoretically speaking, whenever we talk of the pandemic, how many peaks does we often see? Or once we have hit, you can say, a cumulative peak. So after that, do we usually see certain pockets of area based on their own factors, be it density of population, be it infrastructure, or otherwise, would have their own peaks and after peaks?
You see, it's a very relevant question. If you really look at it, most of the time in the modern history, you see, if I go to the nearest respiratory pandemic, which was actually influenza, it in 18, which was so-called the Spanish flu, it was around about 2 years. And then gradually, again, we had an upsurge in 1957 when we had it. And if I go to the medieval one where you have a Black Death, the plague and all, it stayed, was there for around about 3 to 7 years. So depending upon it. Now, what is important for us to understand what Dr. Sarman Singh said is, when I looked at the data of my own state, which we have compiled it, we had two peaks. in a sense, it started, we were lagging behind Delhi around about 2 to 3 weeks. And I think Dr. Madan Gopal is aware about it because they have been closely following the NCR. And when you see the maximum, we saw the surge was in the September, sir. And then it came in October. And end of October, with that, around Diwali again, we had the second peak, which we saw it. And when we looked at our own data, I'm putting it from 2 studies, and that can give you a rough amount of an idea, is that when we did a first sero survey and the second sero survey at the gap of 2 to 3 months, initially it was less than 3%, and later in Haryana it was turning out to be more than 14%. And when we were doing the vaccination studies, when we started recruiting, it was hardly 3% such seropositivity was there. But in the second phase, when we came up, we had more than 15% seropositivity. So that means is an infection which has been there. And from your perspective, most of the time, majority of the thing will have 2 peaks or at the most 3 peaks. That's how one we look at it and we move ahead within the pandemic. And I think, by and large, looking at it from the experience what we had it from Europe and what we have it from the UK, as Professor Sarman Singh and Dr. Madan Gopal has also said it, we need to be careful. I will be comfortable that yes, everything has gone away, because as long as the infection is there or there is a mutant strain which is more transmissible, which is there is a probability of its recurrence. I will be comfortable, as he has said, 28 days, and probably if in the whole of the country, I will say the last day where you have seen those surges. Like if Kerala can't be silent, I do not expect tomorrow. If they have a different strain or a Brazilian strain or South African strain, but on an average, it gives us a give and it up and not to lower our guard.
Right. Dr. Madan Gopal, here it's important question, as we're just discussing about the peaks and after peaks. You know that the numbers are declining. At the same time, are we ruling out any possibility that the variants will have any impact on us, considering so far in last nearly month or so, we haven't seen any phenomenal number of cases of UK strain or South African strain. So are we ruling out strain, or are we still monitoring it strictly and keeping a close eye so that we're not caught off guard in terms of surge, in terms of a new COVID strain?
Rajat, till the time we have achieved that we have controlled the pandemic, we have to keep a vigil, and that vigil is happening. Now genomic surveillance is happening for all the possible mutations apart from UK strain, Brazil strain and the South African. We are trying to find out that what other strains are there which are causing this. As the virus propagates, it mutates. As it mutates, mutation could be favorable, it could be unfavorable, and it usually mutates as the virus spreads, as the epidemic spreads. It mutates. That's right. There. That's the nature of the virus. That's the natural history of the virus. That's there. Genomic surveillance is happening. All the CSIR institutes and the other institutes, they are doing these studies and taking either retrospective samples also they are doing, and they are doing prospective samples also. That kind of modality has been established, and keeping a watch on the progression of the pandemic. And having said this, one important thing which my previous panelist was saying, that the epidemic, we should not lower the guard, because any super spreading is happening and you will have the surge of the cases. With the festivals coming around the corner, then we have to see that how it happens. We have to be very careful about that. While our surveillance is going on, we should not lower the guard and see that the super spreading events happening. If this happens, then we are staring at another surge of cases. That's the caution which we have to take when we are doing all these things. Please.
That's important, Dr. Madan Gopal. We have to take precaution and should not be caught off guard of any new mutant. Professor Singh, we know that virus does mutate. It's a property of a virus to have a mutant, and of course we have seen few strings. Now, in terms of our approach towards this entire pandemic, are we still preparing ourselves so as to keep off any mutant? If I ask you in your own institute, how are you going ahead with dealing with any sort of a mutant?
I think this was expected. Mutation was expected and be published long back in July itself, and this was a prediction which came true. And in all RNA viruses, it is one of the RNA virus, so it happens. But definitely, how the infectious or how severity it carries with. That is more important. So here, what we have seen so far, all the three mutants, they have shown, the spreadability is very high. So means they can, even though virulence is not, neither we can say it is less or more, it is almost same, but definitely transmissibility is very high. So that is there. And fortunately, in India, as per the data, which shows that, some people, they carried it from UK. Through flights, and earlier data which is published, and it is in the public domain in India. So far, we haven't seen many of the cases or clusters or the spread of this as it was expected from the data available from the United Kingdom or the other countries. Fortunate enough for India, we haven't seen too much of the these mutants spreading in the country. As Dr. Gopal also said, it is difficult to say that, in Kerala, it is because of that. But till the whole data in the sample, considerable sample size analyzed, it is difficult to say. But again, I would say rather than mutant, I would, think that this Kerala episode is because of they never achieved the peak. So I think the peak is most important, irrespective of whether it is a mutant or not. So far, let me tell you, this virus and the disease is going to unravel many of the hidden stories for years to come together. Many of the our understanding textbook pictures and these things, they have been found ineffective or not of much use. And therefore, I would definitely like to say that earlier we were very much apprehensive that new mutant in UK which created havoc in UK. So everybody was obvious in India also. But fortunately, again, we are saying so in India, whether it is a wild type, original type, or it is a mutant type, we have remained fortunate enough, and so is Southeast Asia. I would say not only India. I am saying again repeatedly, this is whole of the Southeast Asia. We all have remained comparatively, less, vulnerable for this virus.
Okay.
Sir, may I add it here?
Sure.
I hope Dr. Gopal will agree with me. When we started looking at it from the lab perspective, because Dr. Sarman Singh is a very seasoned microbiologist, so he will bear with me, is that when we started initially, we saw that the CT value which we were talking about were very high. And when the D4 mutant, then 614 mutant came up, and suddenly you see that the numbers of CD values started going very low. That means there was a very low, but we did not see. But yes, we saw the surge in terms of number of cases which were coming up. And secondly, I think this is the time, Dr. Gopal is sitting there. I will request him, and also Dr. Sarman Singh is there. I think this is one of the best things which could happen is a genomic surveillance. That is only going to tell us, and each institute, each state in particular now have to have their own capacity, capability with the support from CSIR or Government of India. But what is important from the long-term perspective is that we need now to have a data in terms of whether you are adenoviruses, whether you are COVID or the coronaviruses and all, because we are realizing it now that in the Southeast Asia, what Dr. Sarman Singh has been mentioning it, that these are the places which had seen quite a few epidemic into SARS-CoV-1, as well as other adenoviruses, coronaviruses. So probably cross-resistance or cross-immunity is also there in these people. So probably that also have been playing some amount of a role.
Right. Dr. Jyotish, just for the benefit of viewers, sir, the CT value, that means a viral load. Is it right, sir?
A viral load. If you have a high viral load is less. If you have a low CT value, It's a cycle threshold because the number of times it needs to multiply.
Right. Many thanks, Dr. Dhruv Chaudhary. Just before we close the show, I just have a minute to squeeze in here. Dr. Madan Gopal, just a last word for you. Let's wrap up the show here. Now, we have seen the numbers. Of course, we are quite satisfied in terms of the numbers the caseload that we're getting. Yet, the area of demise or death happens to be the one where we have to definitely take care of. So, what is the suggestion, or for that matter, the guidelines you would try to reiterate here in terms of not to get complacent here? Dr. Madan Gopal.
As the epidemic is not over, we have to stick to the basics of epidemic management. That is case detection, contact tracing, that we should not be neglecting that. We should see that how many contacts we are tracing for a single case. That's a bottom line. If we fail now, then it will be very difficult because they can act as super spreading events and we can see surge.
Right. Many thanks, Dr. Madan Gopal. I'm sorry, time is short here. Many thanks, Dr. Dhruv Chaudhary, and many thanks, Professor Sarman Singh, sir, for joining us and, of course, taking our viewers to this extremely important issue. Now, before we go, a small appeal to all our viewers. Please keep following COVID-appropriate behaviors so that we should not get complacent and be guarded. Keep washing your hands, keep wearing a face mask, and please maintain physical distancing.